common problem in healthcare is getting in to see a doctor, and that's especially true in mental health care. With more patients than providers, it can be hard to get an appointment. But Vera French Mental Health Center has hatched a plan to help. CEO Dr. Rich Whitaker is here to explain just-in-time scheduling. Thanks for coming in.
You're welcome.
First, before we talk about the solution, let's talk a little bit about the problem. And we've been told that there's been a difficulty when people need to access a mental health care provider trying to get an appointment. Is that the case?
Yes, it is. And you know, the problem really stems from appointments being scheduled out into the future so far that if anybody needs to get in right away, they just have to wait. So access is part of the issue. Another issue is people who have a problem with their medication and need to come back sooner than when they're normally scheduled. They're usually trying to do telephone tag, you know, with the nurse and who's trying to talk to the physician. And we just have so many issues with care being not as excellent as we would hope because of that very issue. So just in time really changes everything, makes it a whole lot more flexible.
Okay, well, let's explain how just-in-time scheduling is supposed to work.
Just-in-time is really, it's something we borrowed from the manufacturing sector. Basically, they don't just build everything and leave it out there in the warehouse. They manufacture it just in time. Well, the idea being with mental health and healthcare, that if we can schedule you just in time, we can get better at when you want to come in, and we can guarantee that you can get in right away if you have an unscheduled need. So basically, rather than set up appointments into the future, we give people a reminder card that they're to call us when they're close to their appointment or when they would normally come in. And then they're able to get in within 2 or 3 days of when they call, because we don't have any appointments further out than that. Everything's open. It's wide open, flexible scheduling for our prescribers.
Okay, well, that makes a lot of sense. You haven't tested this out yet, though.
Well, it's actually kind of in process, and this is actually coming from years of experience from a consultant that's been doing this all over the country. We are definitely not the first ones to do just-in-time scheduling. We just have been working for the last several months getting this all in place, and more recently, clients who have seen us don't get an appointment card, they get a reminder card. And then we'll also do reminders to the person as well as it gets closer to that date.
Yeah. So will this help you serve more clients?
Actually, this is going to help us do a lot of things. Yes, it'll help us serve more clients, because instead of having these appointments out there that we don't know if people are really going to come in, we have open time. That means everybody can get in when they want to. Also, we'll have walk-in times every day, so that people who might miss their appointment, even though they just scheduled it 2 days ago, if for some reason they miss it, they can just walk right in the very next day, or maybe even that day.
Yeah.
Also, it will help us serve more people, because instead of pushing out new patients into the future, new people can get in right away as well. So it really opens that up for flexible, wide open scheduling.
Yeah, it sounds like it would also be helpful if someone's having an immediate crisis and they need to get in right away, right?
That's been such an issue for us, because, for example, you just got put on a new medication. We'd like to have you come back in 2 weeks, but a lot of times the schedule wouldn't allow that, or we'd have to say, we'll try to fit you in. Now we know we can get you back in within 2 weeks, and we just give you a little card that says, call us in 10 days, and we'll get you in right when you need to come in.
All right.
Or just call us and we'll get you in within the next couple of days.
Yeah, so that's in the works now. We'll have to check back with you and see how it's going.
Yeah.
Dr. Rich Whitaker with Vera French, we appreciate you coming in.
Thank you.